Neighborhood Health Watch is sponsored by the doctors of HCA Virginia.
And today in Neighborhood Health Watch, we're talking about kidney stones. 1 in 10 people get them. They are small, hard mineral deposits that form inside your kidneys. And people who have had them will tell you passing a stone is painful. Doctors say they rarely cause any permanent damage, but there are instances where you might need surgery. Dr. Kramolowsky with Retreat Doctors Hospital is here to talk more about the kidney stones. Thank you so much for joining us on First at 4. First, how are the stones formed and what are some of the symptoms?
Well, we don't know the exact reason why they form. We think dehydration is a form that causes them to occur. The symptom that most people get is pain. And it's pain compared to childbirth by many women who have been through both. I have kidney stones myself, and I haven't had any children, but I don't want another kidney stone.
You think it's like childbirth, for real? Wow. How do you treat kidney stones? What's the common treatment?
The most common way to deal with kidney stones is to pass them on your own. That is the safest, best way if that can be done. We try to do that in the majority of patients. However, if you're unable to do that, then surgery is the next option. Now, these surgeries over the years, you can see my gray hair that I've been doing this, has gotten to be a lot less invasive than it previously was. And so most people can get it done as an outpatient and be back to work in very short order.
And who are the people who are most at risk, and how do you prevent them? You talked about hydration, so I guess you need to drink a whole lot of water.
A whole lot of water. You need to live in a different part of the country. This is part of the Stone Belt here in Virginia.
Really?
Kidney stones are very common in this part of the country. Probably because the water's hard, people tend to get dehydrated because the summers are hot and humid, and because of the heredity that people don't travel much. This is the genetics is also a factor in formation of stones.
How would you know you have a kidney stone?
Well, the most common way to find out is when you're laying in the emergency room wishing you were dead, and they do a CAT scan and say, you got a kidney stone. Now, actually, that's a lot better than the other choices, all right, at that moment. But the other way is blood in your urine, frequency of urination, some of the mild symptoms, infection sometimes associated with stones.
I'm getting the signal to wrap, but quickly, there's a 24-hour hotline, though.
24-hour hotline, 560-STONE, S-T-O-N, is a line that you can call 24/7, and the beauty of that line is a human being answers.
That is good.
And that's very helpful when you lay on the floor wishing you were dead. And so we use that line to get you better access. It's all about access in healthcare these days. And that is utilized by over 2,000 patients a year.
Excellent.
Use that, and that's provided by the practice.
Dr. Kramolowsky, thank you so much for joining us.